Well, I'm very excited for you to be here. And today, I might just have turned live. Hi, everyone. Jessie here. So sorry we're running a bit late. I'm having some technical issues here, but let's get started. Well, everyone, welcome to the Masterclass 3 Mistakes to Avoid on a Low FODMAP Diet for IBS Freedom. I'm so excited you've taken the first step to better understand IBS, your body, and how to get relief from your IBS symptoms. While a few more people are hopping on, I'm just going to give it a couple minutes or two. I think we are running into a little bit of technical issues here. All right. Okay, well, I'm going to keep going for the time, for the sake of everybody else that is here. Thank you so much for joining me. All right, welcome. Let's get started. You're in the right place if you want to feel better and find relief from IBS, want to gain control of your symptoms, and you want long-term freedom from IBS and know how to manage your symptoms for good. Before we begin, I'm thankful that you've registered for this masterclass and chose to be here today. So I would love for you to set aside the next 45 to 60 minutes to really focus on everything I'm going to teach you today. Put your phone on silent, put away everything that can be a distraction. I promise it will be worthwhile for your time. If you have any questions, pop that in the question box and I'll address them during the Q&A session at the end. You can put it in the question box or the chat box. I'll look at both at the end. So who is this webinar for? This webinar is for you if you are struggling with IBS, if you're feeling confused with food, and wondering if your guts will ever be normal again. This is not for you if you're not ready to make a few changes in your daily life to feel better, if you're only looking for quick fixes, or if you have an active eating disorder, or if you haven't been to your doctors. A quick disclaimer, the information presented in this masterclass is for educational and information purpose only. It is not intended to be a substitute for medical or professional health advice, diagnosis, or treatment. After this masterclass, you will learn about the 3 dietary mistakes that may be costing you your IBS freedom, what to do instead to find relief, and how to feel better using simple yet effective strategies. All right, if you stay till the end, I've got a gift for you, and that is my 7-day low FODMAP meal plan and recipe guide. We will do a Q&A session at the end too for you to pick my brain. So feel free to drop your questions in the Q&A box and I will get through them later. All right, now, does this sound like you? How many of you would you say you're always bloated no matter what you eat? Is your belly so big that your clothes don't fit anymore? Or are you experiencing bloating or discomfort almost every day? And then you're not going to bathroom for days, but also need to locate a bathroom wherever you go just in case. Are you anxious about when the next flare-up will happen? See. Okay, I'm gonna keep moving. Okay, if you don't know what's wrong, what to eat or not eat, and how to properly adopt the low FODMAP diet for relief from symptoms like bloating, gas, diarrhea, and constipation, then this is the right masterclass for you. All right, before we go into details on how, imagine what it would feel like to not struggle with gut symptoms anymore, to feel confident in your body, and to enjoy all the food you love again. This is Karen, one of our previous group member clients. And let me share Karen's story with you to tell you what is possible. When she came to me, she was severely bloated, was always in pain. She's seen multiple doctors, dietitians, and a naturopath. They told her to eliminate a lot of food. Her symptoms didn't improve, and she became very afraid of food and didn't know what to eat. When we started working together, we first identified what was causing her bloat and severe gut symptoms. She was actually extremely constipated and had to rely on laxatives every day, but she was still not regular. We worked through the FODMAP protocol together and identified lactose and onions were big food triggers for her. We also worked on improving her lifestyle to help her better manage stress and get better sleep. Within 2 to 4 weeks of working together, her bowel movement became regular. So even though dairy and onions were big triggers for her, she now knows what her tolerance level are for those foods, and she can still eat some of it and knows how to manage her symptoms if anything arises. And the most important thing is she's not afraid of eating anymore because she knows her body a lot better. Now, let me share one more client story with you, and that's Erica's. Erica struggled with bloating, and she started having a lot of urgency a few years ago. She would have explosive diarrhea totally out of the blue, and she didn't know what caused all of these. She tried many diets, used a lot of supplements, meal replacements, but nothing worked. Her flare-up got worse and happened more frequently. She had to scout for bathroom everywhere she goes. She was really frustrated and didn't know what to do. When we started working together, we realized she was actually very constipated for days leading up to a flare-up. So constipation was the root cause of her diarrhea. And I wanted to dig deeper and find out why she was constipated. So in the program, we went through different lifestyle challenges and FODMAP challenges to see what was causing her constipation. At the end, we learned that she didn't have any food trigger. She didn't have any FODMAP triggers, as long as she's going to the bathroom every day. For her, it was more lifestyle related. It was meal timing, sleep, routine, stress, hydration, which all played a huge part on her gut. Nowadays, she doesn't need laxative to regulate her bowel movements anymore. And she can enjoy all the foods she used to love, she loves, but she used to be afraid of. And I wanted to share these two stories with you to tell you it's not always food. One of them had a food trigger. One of them had a lifestyle trigger. And it is important for you to know your individual trigger to help you overcome IBS instead of blindly following diets and not living a normal life. Okay, before we go further, let me introduce myself. I'm Jessie Wong, a registered dietitian who specializes in irritable bowel syndrome. I'm trained by Monash University on how to implement the low FODMAP diet properly, and I have over 5 years of 5 years of experience of helping people with gut issues. I'm based in Seattle, Washington, in the United States. And a lot of people ask me why I became a poop specialist. So let me share our story with you. So it started with my husband when he was in graduate school more than 10 years ago. He got a diagnosis of IBS, never received any guidance on what to do. He was always tired, bloated, and always in pain. I was very frustrated with him because I would ask him, so what did the doctor say? And every time he go to the doctor and he comes home and he would always say, nothing, it's just IBS. And that went on for a few years and it really didn't help our marriage at all. Finally, one year, a gastroenterologist told him to try the low FODMAP diet. So we Googled the diet, found this handout online with the yes and no item list, and it was stuck on our fridge from that point on. We eliminated all FODMAPs. That's what we thought we needed to do. And at that time, there were not a lot of resources on the low FODMAP diet. His bloating and pain improved, but it never went away. He would still have flare-ups once in a while. So the problem was there are still nowadays conflicting information everywhere and the lack of straightforward recommendation to help us get better. We didn't know what to do. We went to many doctors, tried many supplements, did many testing, and nothing really worked. So years after the diagnosis, nothing helped. My husband's GI finally one year ordered scopes for him to make sure everything was fine. So the day of the procedure, a different GI did the scope. And the GI told us right before the procedure, said it in front of my husband, you are only getting this colonoscopy because you complained too much. To him, IBS is just a condition that irritates the nervous system in our intestine. He didn't understand the devastation the condition can cause. And it happens to us, like this whole situation happens to us. Someone work in the medical field. Now, years later, since the incident happened, I still think about this a lot. And I think about what others have to go through just to get proper care when it comes to IBS. And I get it. And I hear this all the time from my clients. So after a few years on the low FODMAP diet, during my second pregnancy, that's when I started experiencing IBS symptoms myself. I had severe constipation, even after the pregnancy. Then I went to the doctor, got a lot of tests done, everything was normal. It's just IBS. The bloating, the gas, the constant discomfort really drained my energy away. It was awful, and it wasn't until then I realized how debilitating the condition is. And this is a big reason why I do what I do now, and I love doing my work and helping people find relief and really understand about their IBS. Okay, well, let's go back, to the problem. The problem we had was that we were recommended to try the low FODMAP diet, but we were not given any guidance, and we were on the diet for way too long. Newer research suggests that staying on the low FODMAP diet for longer than 8 weeks can start altering our gut microbiome. And we stayed on it for a couple years, and I believe that might have contributed to me experiencing IBS symptoms and severe constipation during and after my pregnancy as well. So when my husband was on the low FODMAP diet, his bloating was slightly better, but the problem never went away. He still had flare-ups, and he was really afraid of food, because we thought at the time it was the FODMAPs giving him symptoms. And I could really see fear in his eyes when we were with friends and families and eating foods that he wasn't so sure of. The struggle was very real, and it took a mental toll on both of us. So when Monash made the FODMAP training available for dietitians, I jumped on board right away. Then I also did many trainings with doctors, dietitians, and psychologists that specializes in gut disorders. Now I know how to implement the FODMAP protocol properly, and I know that it is only one tool out of many tools. And I'm going to share with you more about this later in a little bit. So once I got trained, we began reintroducing FODMAPs group by group. Identified some of our food triggers at the time, but more importantly, we identified our lifestyle triggers and expanded our diet. Our gut healed over time, and we now tolerate all of the foods. And a reminder, not everyone has a food trigger. For us, we learned that sleep and stress were bigger triggers for our symptoms than food. Okay, let me share another quick story with you. So this is Elvina. When Elvina came to me, she was bloated all the time, couldn't wear her own clothes. Her doctor said it was all in her head because she was stressed all the time. But the doctor also told her not to eat gluten or dairy. And Elvina became very afraid of food. And she was, at the time when she started working with me, she was living off of very few food. She would be constipated for days and have an enormous flare-up that would make her sit on the toilet for hours and leave her drained for days following the flare-up. Then the cycle begins again. So when we worked together, we identified her root cause, again, was chronic severe constipation. And we looked at what was causing her constipation. So she works a very stressful job at a bank, and we found that stress was her big trigger that slowed down her gut. We also reintroduced FODMAPs group by group and learned that she didn't have any food intolerance, especially not to gluten, because that's what her doctor told her to remove from her diet. So she was very afraid of gluten and dairy because that's what the doctor said. So when we were working together, her wedding was coming up. So at the end of the program, because she didn't have any food triggers, she was so excited, and she told me she was really happy now that she can eat all the foods offered at her own wedding. She's another example that food is not the only problem. But often we have to cross food intolerance off the list before we are able to get to other possible triggers. Now, another quick story of a young mother, Sarah. So she came to me again with severe chronic constipation, was using laxative daily, and was still not regular and experienced a lot of bloating and other symptoms. When we went through the FODMAP challenges, we found that she has some FODMAP intolerance of certain groups, and that included beans, onions, and garlic. After the program, she knows her limit, and she knows what to do when symptom arises. She's another example that some people do have FODMAP triggers. Now, the low FODMAP diet has been studied extensively, and we know it helps about 70% of IBS patients. Okay, so before we dive into FODMAPs, what I'm going to share with you now is very important, because to heal your gut, you need to know your body. You need to understand your body and know what's going on to take full control of your IBS. So before we jump into FODMAPs, I want to talk about different types of IBS, because this is very important. Okay, do you know there are 4 types of IBS, and do you know your type of IBS? You can, if you feel comfortable sharing, you can pop it in the chat. But there are 4 different types of IBS. Okay, I'm gonna keep going because we've got lots to share. So let's get started with the different types. Here is the Bristol stool chart. This is what we use to identify what type of stool you have and to help you identify what type of IBS you have and what is causing your symptoms, aka the root cause. Once you know what is causing your IBS, it will be a lot easier to manage. Now let's talk real quick about the 4 different types. IBS constipation means more than 25% of the time, your stool looks like type 1 and type 2 on the Bristol stool chart, and less than 25% of the time, your stool looks like type 6 or type 7. And a lot of the times people tell me they have a regular bowel movement every single day. However, if your bowel movement looks like type 1 and type 2 on the charts, then it's probably not a complete evacuation. The residual stool in your colon is likely the reason why you're always bloated and very gassy. And this is IBS constipation. Now, type 2 is IBS diarrhea. This is when more than 25% of the time your bowel movement looks like type 6 and type 7 on the charts, and less than 25% of the time you look like type 1 and type 2. And there are also different types of diarrhea even within IBS diarrhea. And here are examples of the 2 most common types of IBS diarrhea. One is overflow diarrhea. This happens when you have significant constipation and what we medically call fecal impaction. And that is when when this happened, the stool here is stuck. And when your body tries to produce a bowel movement, all that comes out are the watery and the mushy parts of your stool. And people with overflow diarrhea usually have multiple bowel movements throughout the day, a lot of urgency. Only little bits comes out each time and you never feel empty. And that is overflow diarrhea. Now let's talk about another common type of diarrhea, and that is the flare-up diarrhea. Flare-up diarrhea happens when you're constipated for days and your body can't, and when your body can't deal with the stool burden anymore, a significant amount of stool comes out at once. It can look like this, it can look like this. Usually people feel the constipation and bloating get worse and worse, then all of a sudden something triggers a flare-up and a lot of stool comes out. You could be in the bathroom for hours and a significant amount of stool would come out, and that's when you know it's a flare-up diarrhea. The stool amount is a lot more than what your usual bowel movements are like, and that is an indication of constipation leading up to flare-up. Now, with both flare-up and overflow diarrhea, these are caused by constipation. To resolve them, you need to resolve constipation. Now, another root cause to IBS diarrhea is potentially a food trigger. Some people do have a food intolerance, and in those cases, you need to identify your food trigger to resolve the diarrhea for good. So there are different types of diarrhea within IBS diarrhea. Know your root cause so you know what to do. If your root cause is a food trigger, then remove that food trigger from your diet or know how much you can eat. If your root cause is constipation, then you need to resolve the constipation to stop the diarrhea for good. Okay, type 3 is IBS mixed bowel type. In IBS mixed bowel type, more than 25% of the time is type 1 and type 2 on the Bristol stool charts, and also more than 25% of the time is type 6 and type 7. This is very similar to flare-up diarrhea, and it is again caused by chronic constipation. Number 4 is IBS unclassified. This is when patients who meet the diagnostic criteria for IBS for symptoms such as bloating, irregular bowel habits, cramping, etc. But you can't be accurately categorized in the other 3 groups. Now, you may not recognize what type of IBS you have, and this is where you talk to your doctor or your healthcare provider to understand. You document your symptoms, you bring it to them, and they help you to identify. And that's something I do for my clients as well. And in my self-paced program in IBS Freedom, what I teach you is how to document your symptoms so you are more informed about your own condition and you know what information to share with your healthcare provider so you get the right diagnosis faster and learn about your root cause faster. Okay, now that we're done sharing the basics of IBS, let's talk about FODMAPs. That's what you're here for. The biggest thing I want to share with you today is the 3 mistakes to avoid while you are on the low FODMAP diet for IBS Freedom. Okay, before we dive into the mistakes I see all the time, let's talk about what the low FODMAP diet is first. First thing first, it is not a long-term diet, as its name suggests, but a short-term elimination with reintroduction. There are 3 phases to the low FODMAP diet, and I really like to call it a protocol instead of a diet because it is more straightforward and you know it's not a long-term diet. Anyways, phase 1 is elimination. So for about 2 to 6 weeks, you want to eliminate certain high FODMAP foods from your diet. And that's going to help you bring your bloating and your symptom down to baseline and also give you time to investigate your root cause. Because when you're not as distended all the time, it will be easier to see your bowel pattern and easier to see what may be going on and what other symptoms you are feeling in your abdominal area or in your gut. Now, after that, and maybe after resolving your root cause too, working with your provider or working through IBS Freedom by yourself, then you follow through with the reintroduction of FODMAPs group by group to learn about your tolerance to each group. There are 11 groups of FODMAPs and FODMAP subgroups, and I usually have my clients test them out one at a time. Once you test it out, you are going to know what you tolerate, what you may not tolerate, and how much you tolerate, so you can safely expand your diet. And that brings us to step number 3 of the protocol is personalization. Because after the process, you will have a better understanding of your body and you can safely expand your diet that way once you know your triggers and your tolerance level to those trigger foods. And this is the low FODMAP diet or protocol in a nutshell. Okay, mistake number 1 that I see all the time, not doing the low FODMAP diet correctly. If you've been recommended the low FODMAP diet and if you're doing it by yourself, you may not be implementing it correctly. And this is actually what happened to my husband and I after we were recommended the low FODMAP diet by his doctor and printed out our 1-sheet guide with what to eat and what not to eat. And I'll tell you, it was from Stanford University. And I was like, okay, this is what we need to follow. And at that time, this was about 10 years ago, there were not a lot of guidance on the low FODMAP diet, so we really have no idea. Nowadays online, there are so much information on low FODMAPs, and most of the information I see on the internet, they are not up to date, and oftentimes they have misleading information. So be very careful of that. And when you don't do it correctly, you may not get symptom relief, and you might be staying on the low FODMAP diet for too long because you don't know how to introduce FODMAPs for your symptoms, or your symptoms may come right back when you try. Okay, and when you stay on it for way too long, you can't live a normal life because you have so much food restrictions. All right, let me move on. Okay, so the problem with trying out low FODMAP diets and not doing it properly, sometimes you may be doing it on your own, sometimes you might be getting resources that are outdated, or the practitioner you're working with, they are not properly trained, and it happens all the time. And with outdated lists, you could be eating things that may be higher FODMAP nowadays than before because Monash updates their list all the time. And or you might also be doing the all or nothing approach with the low FODMAP diet, and this is cutting out all fibers. FODMAPs are fermentable carbohydrates. Most of them are fibers. And what I see a lot of the time is people are removing all of it. And that can impact your gut function as well. And I'm going to talk more about that in a little bit. Now, Another problem I see that people get into problem with is not knowing what ingredients are low FODMAP or not. So that sometimes they might be eating a serving of food that is probably low FODMAP if just one serving. But if you didn't know, if you're eating multiple serving of that food, you could be stacking FODMAPs and causing some symptoms. And you may not even know that. So be careful. I would say read the ingredients list, cross-check it with the Monash list, or if you're in IBS Freedom, I know some of the members that are here are already in IBS Freedom. We have all of the resources for you in Module 2. Make sure to check that. Okay, now when people are doing low FODMAP diet by themselves, or if you're working with a provider who are not properly trained, chances are you're not implementing it properly. And you may not be getting symptom relief because of that. And you might be staying on low FODMAP for too long because you don't know when is a good time to reintroduce. Or when you try to reintroduce, your symptoms come right back. And when you don't know how to reintroduce and pinpoint your trigger, you are giving yourself unnecessary food restrictions. And you can't live a normal life when you have so much food restrictions. And like I said earlier, newer research suggests that prolonged elimination of FODMAPs can alter our gut microbiome, and sometimes that can mean making you more sensitive to FODMAP groups. Now, let's talk about how to fix it. If you are currently on the low FODMAP phase, make sure you're doing it correctly. Work with your provider, ask them a lot of questions. And during the elimination, you also want to make sure you are getting enough low FODMAP fiber to support gut function as well. For most adults, the recommendation is 25 to 35 grams of fiber per day. So you want to make sure you are slowly adding fiber back into your diet. And when you're on the low FODMAP phase, you want to be adding the low FODMAP fruits and vegetables to your diet so that you are increasing fiber that are not causing more symptoms. Some of you are already in IBS Freedom. There is a resource in Module 2 to help you on that and help you get to that point where you're getting enough fiber. Okay. So once you go through the 2 to 6 weeks of elimination and investigating your root cause and probably resolving your root cause, then it is time to reintroduce FODMAPs group by group. So you learn your tolerance and limits and then expand your diet. Either by yourself, if you know your triggers and your limits, or work with a dietitian that is familiar with your case, or talk to your healthcare provider about this. I would say most doctors are not trained on a FODMAP diet, so work with a dietitian if you can. If you can't, we do have IBS Freedom that really helps you. Okay. Now, one thing I hear all the time is when people are eliminating a lot of food, you get more and more sensitive to those foods, and also you may get more gut symptoms. And one thing we know per research is eating a wide variety of food is key to having better gut microbes and better gut health. And when you're cutting out a lot of food, that can adversely affect your gut microbiome. Now, if the food you're cutting out are your food triggers, then that's okay, because if you're eating your food triggers, it can cause more inflammation in your gut. But if you are cutting out food because you don't know how to reintroduce, then I would really encourage you to work with a dietitian or join IBS Freedom to learn about how to reintroduce FODMAPs group by group. Okay, let me share with you one of my past client stories. So this is Jennifer. Jennifer suffers from chronic constipation, and she was recommended by her doctor to try the low FODMAP diet. She brought a low FODMAP book from another dietitian and was doing the low FODMAP diet by herself for a whole year. She became very afraid of FODMAPs, and she didn't know how to reintroduce. So she actually joined our program, and we worked together for a few months. So when what we first did was to regulate her bowel movement and work on her diet and lifestyle while getting through the FODMAP protocol. And the funny story about her that she joins the program because she saw a post of me making croissants, and she was very shocked that I could eat croissants while on the low FODMAP diet. And when we chatted, I told her I don't eat low FODMAP anymore. And she was really shocked. And I told her, you probably don't need to eat low FODMAP too. What you need to do is reintroduce the FODMAPs, understand what you can tolerate and what you can't tolerate, and then expand your diet. So what happened to her was that she was recommended to try the low FODMAP diet by her doctor, by her GI. But no one told her it was temporary. And because she had severe chronic constipation and she wasn't doing the low FODMAP diet properly, she actually didn't have much relief from the diet. Her bloating was better, her gas was better, but she was still constipated. And she was very afraid of reintroducing FODMAPs because every time she tries to reintroduce FODMAPs, the gas and the bloating come right back. Now, because if you are constipated, if stool is stuck in your colon and you eat fermentable carbohydrates, they are going to ferment and they're going to cause you to have a lot of gas. When we started working together, the first thing we did again was to regulate her bowel movement. After that, we reintroduced FODMAPs group by group. And when we worked through the FODMAP reintroduction, we did find that she had one group of FODMAP intolerance, and that was beans. So she knows her limits now and knows what to do if the constipation comes back. And she can eat croissants without worry nowadays. So this can be you too. So don't just dwell on the restriction part. Make sure you are also resolving the root cause and reintroducing FODMAPs so that you are feeding your gut microbes and get better. Okay, so that's mistake number one that I see all the time when people don't do it properly. Mistake number two, again, something I see all the time, and I kind of mentioned a little bit in mistake number one, is the all or nothing approach with food and unnecessarily removing food or food groups. So I see this very, very often. And a lot of people before working with me have tried or have told me they have tried gluten-free diets, dairy-free diets, and cutting out a lot of things with no results. And some people even have cut out fruits and vegetables or even grains. The problem with these is these approaches are very extreme and it causes a lot more food fear for people. If you experience a little bit of symptom relief, but not complete relief, and you're not sure if it's helping you or not helping you, that causes confusion. That causes a lot of food fear. And when you cut out so many food groups like this, it probably won't give you lasting or long-term symptom relief, but also put you at risk of nutrient deficiency and can be making your symptoms worse in the long run. All right, let's talk about the problems with these diets. Now, some people do have a gluten intolerance, and that's something you need to identify before cutting it out because the gluten-free diet is very, very difficult to achieve. With the gluten-free diet, most gluten-free products on the market are highly processed, they're very low in fiber, and most of the time they're very poor in nutrients. So if you don't have to go gluten-free, please don't go gluten-free. Now, if you are someone who suspects gluten intolerance, definitely work with a dietitian who knows how to help you to understand if you have an intolerance or not. But most people with IBS don't have a gluten intolerance. Now, a lot of people also cut out dairy, and I see a lot of fear-mongering messages on the internet from providers across the board saying dairy is inflammatory, dairy can cause you harm. Dairy is not the problem. Some people may not tolerate lactose. Lactose is the sugar in dairy products. Lactose-free may be helpful for some people, but you don't need to be dairy-free. Now, if you have lactose intolerance, you can probably still incorporate a little bit of lactose-free dairy products in your life, such as hard cheeses and lactose-free milk or lactose-free yogurt. You don't have to cut out dairy completely. With lactose is actually one of the FODMAP groups we challenge in IBS Freedom. So with lactose, you do a challenge to see what your tolerance is at. And most people can probably tolerate a small amount. So don't be afraid of dairy products. If you're lactose intolerant, you just need to remove the lactose from your diet. Now, if you are removing a lot of fruits and vegetables in your diet, that is a really big problem because, again, it can cause more symptoms in the long run because it can really alter your gut microbiome. And that's what we don't want to happen. But that's what we see sometimes when people do the low FODMAP diet for too long or when people follow certain diets that are cutting out things like fruits and vegetables. And sadly, there are a lot of misinformation on the internet about those kind of diets. Now, let's talk about how to fix it. So when it comes to understanding your food trigger, you really need a targeted approach based on your symptoms and also think about how to optimize your gut microbes. So if you are recommended the low FODMAP diet, eliminate and reintroduce in a timely manner. then you can safely expand the variety of your diet and not cause more long-term harm in your gut. Now, if you are afraid of reintroducing FODMAPs or not sure where to do, you should always work with a specialist dietitian to help you, okay? And what we do is we can help you recognize first any mistakes that you may be making, and we can lead you to systematically eliminate and reintroduce food so you know your food triggers. And that's something we do in IBS Freedom. It's a dietitian-led program to help you eliminate properly and reintroduce the FODMAPs and FODMAP subgroups systematically. So after you work through all the 3 steps of the low FODMAP protocol, then it is a time for you to safely expand your diet and support your gut health and support your gut microbiome without worrying about symptoms. All right, I want to share one more client story with you. This is Pat and Bob. So Pat and Bob are retirees, and Pat started having diarrhea a few years ago. She would go to the bathroom multiple times a day with a lot of urgency. She was afraid of leaving her house because she doesn't know when she would need the bathroom. Her doctor suggested the low FODMAP diet, and that's when they joined the program. And after she started the program, she quickly realized she was actually having overflow diarrhea. This is a kind of diarrhea we talked about earlier that is caused by severe chronic constipation. Once we regulated her bowel movement, her diarrhea stopped instantly. And when she reintroduced all the FODMAPs group by group, she did not have a lot of significant food triggers. There were a couple foods that caused some symptoms, caused a little bit more bloating, a little bit slower gut motility. But she now knows her food trigger, and she can personalize her diet and expand her diet safely after the program. And she said the program has significantly improved the quality of their life, and she was no longer afraid of going out because of her gut symptoms and because she don't have urgency anymore. And they loved the gut challenges and the recipes so much. She wrote in her testimonial, Jessie's menu ideas were quick and simple, and as a bonus, they taste great. She made it so easy so that we didn't have to continuously search for what to eat. And Jessie's program is straightforward and lays the plan out step by step. She takes the guesswork out and confusion for you. So this is one of our IBS Freedom clients. We did have a session together to help her lay out some of the steps, but she followed through with the modules and also the video so that she reintroduced the FODMAPs by herself successfully. Okay, so that was mistake number 2. Really work with someone who knows what they're doing, or join IBS Freedom. It's a dietitian-led program to help you get through the 3 phases. Now, mistake number 3. This is especially important for you if you are only focusing on food and not looking at the whole picture when it comes to taking care of your body and improving your gut function. And I've said it before, food is important, but it is not everything, which is why we need a holistic approach when it comes to recovering and healing from IBS. Okay, now, does this sound like you or me? I think we all struggle with some of this at different times of our life. Are you stressed all the time? Do you feel stressed all the time? Or are you not getting enough sleep? Are you not getting 8 hours of quality sleep? And sometimes are you exercising too much or not exercising at all? So all of these are extremely important because it can impact our gut-brain connections. So IBS is a gut-brain axis disorder. And what this means is that our brain and our guts are not communicating at the right pace. And that can cause more pain, bloating, diarrhea, and constipation for people with IBS. And in the past, we have always thought that the gut-brain connection is a one-way street. Our brain communicates with our gut. Newer research suggests that it's not the case, and in fact, it's a two-way highway, and it is connected by the vagus nerve. So our brain affects the function of our gut, and our gut affects the function of our brain. And mainly in our guts is your gut microbiome that affects the gut function of our brain. Right? So we want to keep those little guys happy. So in order to heal our gut, we need to fix our gut-brain axis. And we need to activate our gut-brain axis by taking better care of our body and also using some strategies to stimulate our vagus nerve. Now, let's talk about the common problems of the modern age and what we can do, right? So if you are not sleeping enough, this can increase our stress, it can increase inflammation in our body, and it can actually decrease our gut microbiome diversity. And that can lead to worsened gut health, and it can cause, and decreased gut microbiome diversity can also cause more stress too. So this is really a vicious cycle of things that we need to break one thing at a time. So improve your sleep duration for some of us or quality for others is very, very important. Now let's talk about stress. Managing stress is also extremely important. Stress can slow down or speed up our gut, and it can cause constipation, diarrhea, or even severe cramping. Stress also increases inflammation in our guts and also overall in our body because it does increase our cortisol level, and it also feeds our brain negative signals, causing the brain to be disconnected to our gut. It disrupts our gut-brain connection, okay? So let's talk about exercise here. So high intensity exercise is very popular nowadays. However, for most people with gut symptoms, this is probably not something I would recommend because high intensity exercise actually draws blood away from your gut. And that can lead to increased inflammation in your gut and leading to more damage. So my recommendation I'm actually going to share with you next is how to fix it. But let's talk about exercise since we were talking about that. So my recommendation on exercise is actually choosing something that is right for you. And normally I would say choosing something that is moderate in intensity and stay well hydrated. And things that are moderate intensity could be walking, speed walking could be one. It could be cycling. It could be taking an easy hike or jog around your neighborhood. Like these are all exercises that you can do that is not going to cause more damage, but helps your blood flow better and help you breathe a little bit deeper, and that stimulates the vagus nerve too. Okay, now for sleep, really work on improving the quantity and maybe quality of your sleep. So aim for 7 to 9 hours of high quality sleep every night. It is so important for our gut health when sleep is so important for our gut health and overall health. And manage your stress. And this is where I'm actually going to share with you my favorite stress management tool when it comes to IBS. Okay, so the deep diaphragmatic breathing is my favorite too. And the reason is because it's very simple to do, and not only simple, nobody needs to know that you're doing it, and you can do it any time of the day when you feel like something is going on, or if you're someone who are very anxious about eating food, I would recommend pairing this with eating. So do a few deep breaths before you eat, so that calms your gut-brain axis down. It helps improve your digestion, and it helps you feel better. Okay, so when you do the deep diaphragmatic breathing, what you do is you breathe deep into your diaphragm. So your diaphragm is going to pull down, and when you do that, you are stimulating your vagus nerve, and that activates your parasympathetic nervous system, the calm system, to reduce stress and improve your gut-brain connection. And when the diaphragm is down into your intestines, because when it pulls down, it goes into your intestines, it also massages your bowels, your colon. So it's very helpful on many fronts when it comes to managing IBS. Okay, so we'll do a quick exercise together if you are in a comfortable place. So breathe deeply into your belly. And that is the kind of breathing, let me show you. I don't know if you can see here. That's the kind of breathing where your belly goes outward. I don't know if you can see that. And I'm going to use this bell here to help you stay focused so that you can just listen to it and breathe in. So what I'm going to do is go ahead and we'll do 4 deep breaths together. So what we're going to do is you breathe in for 3 seconds, you hold it for 3 seconds, breathe out for 3 seconds, hold it for 3 seconds, and then breathe in again. Okay, we'll do a set of 4. So I'm going to use this bell to ring it so that you can hear when the start is and when the end is. All right, then I'm going to count for you. All right, breathe in for 1, 2, 3. Hold it for 1, 2, 3. Breathe out for 1, 2, 3. Hold it for 1, 2, 3. Breathe in for 1, 2, 3. Hold it for 1, 2, 3. Breathe out for 1, 2, 3. Hold it for 1, 2, 3. Breathe in for 1, 2, 3. Hold it for 1, 2, 3. Breathe out for 1, 2, 3. Hold it for 1, 2, 3. Breathe in for 1, 2, 3. Hold it for 1, 2, 3. Breathe out for 1, 2, 3. Hold it for 1, 2, 3. All right, I hope that makes you feel better, and thank you for doing the breathing exercise with me. All right, now let's move on. Okay, well, let me share one more client story with you. So this is Candice, and she actually worked with me in a small group program. And when she first joined our program, she was very bloated. She was grumpy all the time because of the discomfort. So she's actually a healthcare provider herself. And in the past 20 years, she's had 3 surgeries related to constipation. And because she's a healthcare worker, she works a very busy and stressful job. She was extremely frustrated with her condition and just didn't know what to do. So when she went through the program, we realized stress was a huge trigger for her. She held a lot of tension in her abdominal area, and that slowed down her gut significantly, leading to chronic constipation. So we also worked on optimizing her diet and also rebuilding her gut microbiome by expanding her diet and variety that she's eating. She then started having regular bowel movements within weeks into the program. And after doing all the FODMAP challenges and the gut challenges, we learned that she didn't have any food triggers. For her, she needed to be well hydrated, eating enough fiber, and also managing her stress. She said the gut challenges has really helped her learn more about her body so that she knows how to manage her IBS moving forward if symptom ever arises. And the gut challenges that she's talking about is the lifestyle challenges in IBS Freedom, where you work on one thing at a time to really optimize your lifestyle. So making small changes in different places on how to improve sleep quality, how to decrease stress, how to choose the right exercise, and also other activities that can help activate your gut-brain axis and stimulate the vagus nerve. And it is one of the most crucial parts in IBS Freedom and what I do with my clients. So before we move on, let's recap real quick the 3 biggest mistakes that I see all the time. Okay, mistake number 1, you may not be implementing the low FODMAP diet correctly if you're trying to do it by yourself. So make sure you're doing it correctly. Mistake number 2, that you may be doing the all or nothing approach with food and unnecessarily cutting out food or multiple food groups. Mistake number 3, you're only focusing on food and not taking care of your body. And this is the lifestyle part that we always talk about. Improve your lifestyle to improve your gut-brain connection. So to fix these mistakes, right? And this is my 3 steps holistic approach. Step 1 is follow through the low FODMAP protocol properly and understand your own food trigger. So learn how to adopt a low FODMAP diet, then safely reintroduce food to find your triggers, and then you can eat the food you love again once you know what you tolerate, what you don't tolerate, and fall in love with food again. Ultimately, this step is to help you expand your diet and not restrict further, okay? Number 2, work with a dietitian if you are stuck, or join IBS Freedom, where I help you get through all of the process in the low FODMAP protocol. So it's a dietitian-led program to help you find relief in IBS symptoms and also work through the FODMAP protocol properly. Now, step number 3 is improving your lifestyle to enhance your gut-brain connection. A lot of the times we throw out big words like your vagus nerve, your gut-brain connection, your parasympathetic nervous system. Ultimately, what is most beneficial is small changes to your lifestyle that benefits you long term. So I actually break it down step by step for you what to do so you can see if any of the little steps helps you feel better. And we do that in IBS Freedom. And when you do those little challenges, you will understand your body better, such as, exercise, stress, water intake, and sleep. And for women, menstruation cycle as well, how it affects your body and how it affects your gut symptoms, so that you can make small, sustainable changes to your lifestyle to enhance your gut connection and provide lasting relief and freedom from your IBS symptoms. So let me ask you a question. Can you envision a life without bloating and gut symptoms, and how would that change your life? Take a second and think about that. If you feel comfortable, you can share with us. You don't have to. And yeah. And okay. I want to ask you a few things. Are you on the low FODMAP diet? Are you finding any symptom relief if you are cutting out a lot of food? Is cutting out food messing up with your life because you have such restrictions with food? Or are you constantly canceling dates or plans or life because you need to stay home for gut symptoms? Are you missing work or not performing your best because of gut symptoms? And last but not least, I think I can really relate to this is your gut symptoms costing you your relationship with others because you're always in pain and always grumpy. And I say I can relate to it because that was how our marriage was for the first few years, when I didn't understand about my husband's symptoms and he was just so tired, so grumpy all the time because of the bloating, the constant pain. And of course, he was taking off work many days of the year too because of his gut symptoms. Yeah, and I'm going to share with you more about IBS Freedom and also how to adopt a low FODMAP diet properly. Okay, so earlier I shared with you my client's current story. So she was in my first ever IBS Freedom program, and recently she sent me a message giving me an update. So she had chronic constipation before, but we resolved it because she did have some food triggers. So in her message here, she had a constipation flare-up after 2 weeks vacation. So she said here, after 2 weeks of summer vacation that I had with my toddler, work, life, and eating whatever, whenever, I had a very bad constipation and abdominal pain. I took Normalax, went to low FODMAP diets, and took a day off from work and just relaxed at home since I couldn't walk because of the pain. Now I am a lot better thanks to all of your info and the program I took a year ago. Please remember you're doing an amazing job helping people. So she was one of my early program participants, and also she got pregnant on the program. Now, the program is not for fertility, but when your gut is getting better, likely other things in life will improve as well. But I just want to share an update with you because with IBS, what you need to know is how to manage your symptoms so that you have the tools to manage moving forward. Now, the biggest problem is that I find that people struggle with is there is so much information out there for IBS or even the low FODMAP diet. And oftentimes they are conflicting information. It's hard to figure out how or even where to start. And sometimes life gets in the way. And where do you go if you get stuck, right? And this is where I want to share with you about IBS Freedom. So this is my very affordable program for you to work through the FODMAP protocol, for you to understand more about your IBS, and more importantly, for you to work through the FODMAP challenge and improving lifestyle as well. So this is the baby. This is my baby. So after years of experiencing and using a holistic approach, I wanted to create something affordable and accessible to help as many people as possible to find freedom from IBS. Because as you know, after listening to my story with IBS and helping people find freedom and also heal from IBS, this is very personal to me. After healing our own IBS symptoms and spending years studying and working with hundreds of IBS clients, I have developed this step-by-step approach that can help most IBS patients to find symptom relief. And I'm excited to introduce you to IBS Freedom. This is an accessible and affordable way to learn how to adopt a low-FODMAP diet and also improve your lifestyle so that you know how to find relief, how to prevent your symptoms, and what to do if symptom arises. Okay, and how this works. So IBS Freedom is a holistic program to help you manage IBS and get relief from symptoms like bloating, gas, pain, reflux, and irregular bowel habits. It is a self-paced, on-demand training with community. You have access to personalized meal planning. I have over 100 recipes in the program to help you and guide you through the low FODMAP protocol to find relief. There are step-by-step guidance with over 50 short videos and actionable workbooks and walk you through my 3-steps approach to IBS Freedom. So you know exactly what to do to feel better. And a lot of the times people see results pretty quickly. If you follow all of my strategies, some people see symptom relief in as soon as 2 weeks. So upon joining, you'll immediately gain access to IBS Freedom membership site, which will equip you with all the necessary tools to effectively manage your IBS. And that includes the entire IBS Freedom Training Library on demand. There are 3 weeks low FODMAP meal plan to help you get started and a lot of guidance on the low FODMAP diet. We also have a private Facebook community for me to answer your questions. And we also have bi-weekly coaching calls. So every month I run a coaching call 2 to 3 times to talk about a specific topic and also to answer questions. Because with IBS, even though the program is amazing, it's not one size fits all, and you will have some questions. And I want to be there to answer your questions to make sure you are following through with the low FODMAP diet properly and you are finding relief. And the coaching calls are led by me and my team of experienced dietitians. During these calls, we'll help you with your personal triggers and answer your questions too. And the calls are scheduled at various times to accommodate schedules and time zones, and they are recorded for you to rewatch in the on-demand library. And also we are launching a private podcast for member only so that if you don't have time to watch the video, you can plug in your headphones and listen to it. Okay, and we also, of course, have the IBS Freedom community. So this is a group of people who are working through the program together. Living with gut symptoms can feel very isolating, but our community provides a supportive network of like-minded individuals who understand what you're going through. And in here, you will receive support and advice from other members and our team. So you no longer will have to feel lonely in managing your IBS. So let me go through with you what you'll find in your IBS Freedom on-demand training library. So you'll learn how the gut functions, what is normal, what is not normal. So this is in module 1. And you'll learn about different types of IBS, identify your IBS subtype and potential root causes to your IBS so you can create a personalized plan on how to move forward with your IBS subtype. So in module 1, you get the tools to document your symptoms. And give you this by documenting your food and your symptoms, this will give you more clarity on what's going on with your gut. And this is to empower you to learn more about your body so you can have informed discussion with your healthcare provider and choose the most appropriate treatment option for your specific case. I also, of course, have videos on how to find relief with constipation and how to find relief with diarrhea. And I also teach you how to dose laxative as well, because that is very individualized too. And so it's very straightforward. All the videos give you step-by-step guidance and you follow through with the workbook. Now, in part of the program, so one of the main steps of my program is the low FODMAP diet. So you will learn how to properly adopt the low FODMAP diet. So you have everything you need to be successful on the low FODMAP diet all in one place. These are reliable, up-to-date information for you to get you through the low FODMAP challenge so that you know your food trigger. There are shopping lists, meal plans, recipes, for you to be successful. There's also a cheat sheet to help you eat out while on the FODMAP confidently. There is, I don't know if you can see it here, but there is a low FODMAP guide to help you get more fiber while on the low FODMAP diet, because that's one thing we talked about. People go all in, cut out everything, and they don't get enough fiber to support their gut function. So there is a specific lesson in the module that talk about how to get enough low FODMAP fiber so that you are successful and you are avoiding the mistakes that I was talking about while implementing the low FODMAP diet. So next, you'll learn about optimizing your gut for healing and supporting better gut function moving forward. These are trainings and workbooks to teach you what is important in terms of diet and lifestyle to support proper gut health and help your gut heal from IBS. It also includes a series of weekly challenges to help you establish the dietary recommendations to support proper gut function. Now, changing dietary habits or lifestyle are not easy, but the step-by-step challenge will help you make sustainable change that will benefit you for life. And you'll have access to education videos and more weekly gut challenges to help you make sustainable change to help manage your IBS symptoms. In this module, we focus more on the lifestyle factor that can be making your gut symptom worse, like sleep, stress, exercise, and also for women, menstruation cycle, learning more about your body so that you know what to do at different phases of your cycle. And again, with these challenges, they are there to help you activate your gut-brain axis and to improve the communication between your brain and your guts. And that's really going to improve your gut symptoms. We'll also talk about exercise and choosing the right exercise for you. And if you loved the breathing exercise we did today, you will love this section of the IBS Freedom, because you are going to learn about mindset changes as well and how to manage stress and simple strategies to improve your sleep quality. Many of my past clients say that these are the habits that they carry on after the program is over because it really helped them feel so much better on a day-to-day basis. And this is the core of a holistic approach in managing IBS so that you'll be able to achieve IBS freedom for the long term. Okay. Well, let's talk about FODMAP reintroduction too. So in the previous slides, I showed you that is how to adopt the low FODMAP diet properly. And then I have a whole module talking about how to reintroduce FODMAPs group by group. So there is an entire section in IBS Freedom about reintroducing FODMAPs systematically, so you know which group causes you symptoms and you know your tolerance level to each group. And this is what most people either don't do or aren't doing correctly. And I will teach you how to reintroduce FODMAPs to find your food trigger and ultimately expand your diet so you can feel better and eat more of what you love again. So each group of FODMAPs and FODMAP subgroups have their own video and their own handout. So you know what they are, what they do in the body. And here is a quick example, excess fructose, and quick example of how we do FODMAP challenges here. So you pick out one food from the list here and you challenge it over 3 days. You can, and it will, after you do the challenge, it will represent your tolerance for the whole group of excess fructose. Each of the foods or the FODMAP groups, they have their specific amounts that you need to challenge. So in here, you can see you can use asparagus, you can use mango or other ones on the list. And day 1, you can what your challenge is eating 1 spear or 15 grams of asparagus. Day 2 is 2 spears, 30 grams. And day 3 is a whole serving, and that is 5 spears of asparagus or 75 grams. So once you go through it, you can document any of your symptoms and you know what your tolerance level will be. So in here, I don't know if you can see it, this is a list of the 11 groups of FODMAPs and FODMAP subgroups. And each group of this FODMAP subgroup, they have their own handout and their own video. So you know exactly what to do. The IBS Freedom Program really takes the guesswork out of it so you can challenge them properly. And once you know what you tolerate and the level of your tolerance, you can safely expand your diet for the whole FODMAP group. Okay. So Again, the last part of IBS freedom is creating a long-term plan. Like what you heard from what Karen said, first we need to identify what is going on, right? If you have a food trigger, then we need to create a long-term dietary plan. If you have a lifestyle trigger, then you create a long-term lifestyle plan that works for you. And once you know your triggers, you don't have to worry about what food will give you symptoms anymore, because you know, and you won't have any more anxiety around food because you know how to take control of your guts and have regular bowel habits. And like what you heard from Karen, what Karen said is she has the tools she needs if a flare happens. And what I really love about her message is she went on a vacation, she ate whatever she wants, she did whatever she wants. And yes, she did have symptoms after 2 weeks of vacation, but she knew exactly what to do to get her symptom under control and get back to her life. So this is what we do in IBS Freedom. Once you learn more about your body, you can create that individualized plan for yourself so that you know what to do moving forward. And like I said earlier, we have an IBS Freedom community, so you won't feel isolated living with gut symptoms. And there is a lot of stigma when it comes to gut symptoms or even talking about poop, but we all eat and we all poop. And in this community, people are sharing what they're struggling with, people are sharing their wisdom when it comes to food, and people are sharing what helps them to feel better. You won't feel alone in this community here. And like-minded individuals who are also going through IBS Freedom supports one another, and you will hear advice from other members and from our team as well. So you will learn and get support from all of us. And of course, within IBS Freedom, you will have new guides, new training, and coaching calls available every month. So you're going to feel confident in taking on whatever task we have in there for you. If you have any questions, drop it in the group. Myself or my team member will always answer your questions, and we will answer your questions in coaching calls as well. So if you join the program, I really encourage you to join us on our coaching calls. Okay, let me share an IBS Freedom participant with you. So this is Patricia. She was one of the beta members of IBS Freedom, and she worked through the program on her own. We've never had a conversation before, and this is what she wrote in our Facebook support group. So happy Thanksgiving, everyone. Today, I am especially thankful for Jessie and the IBS Freedom course. My symptoms are under control. I feel so much better, and I have the tools I need to keep it that way. Thank you, Jessie. So she's someone who worked through the program on her own without any conversation with me. She was a member in the Facebook group. She's been there, but we never had a conversation. She never joined one of the coaching calls, but she worked through the program on her own by herself. And she was able to learn about her body and get her symptoms under control. So this is what is possible. Now, this is Joanna. She's one of our beta members of IBS Freedom, and she worked through the program on her own. We've never had a consult before, but she did ask questions in our Facebook support group, and I answered her questions during coaching calls as well to help her move forward with the IBS Freedom material. And this is what she wrote. So she emailed me with a testimonial. So she wrote, "Hi, Jessie. I have struggled for years with constipation, bloating, gas, diarrhea, and pain. I would say I have tried everything or even lots of things, but my symptoms were escalating. I had been a regular exerciser and generally made healthy food choices and just couldn't understand why I was struggling with GI symptoms. My gastroenterologist ruled out celiac and said you probably have IBS like the majority of people I see every day. Well, that wasn't good enough for me. I was tired of feeling bad and stressed out about food and the bathroom. So I tried Whole30 and felt amazing, but didn't identify specific triggers at reintroduction. I was frustrated. I spoke to a functional nutritionist whom I truly believe had my best interests at heart, but her program was expensive and required lots of tests and supplements. And like Whole30 was not sustainable for my busy lifestyle. I mentioned my concerns to a dietitian through a wellness program at work, and she recommended I consider the low FODMAP protocol and find support from someone specifically trained in low FODMAP diet. And this is how I found you, one of a few Monash FODMAP certified dietitians in my state. But at last, you had just moved out of state. I followed you on social media anyway and learned about your services. around the holidays last year, discounted your IBS Freedom course. So that was back then when the course was $500. I'm pretty self-motivated and thought it would be worth a try on my own. I'm so grateful you put this course together. I learned so much about anatomy, physiology, hydration, nutrition, and honoring my physical, mental, and emotional need. I now know my triggers and how to avoid issues or manage them if they arise. And the best part, I didn't identify any FODMAP triggers. Rest, hydration, fiber, joyful movement keeps me where I need to be. It's an amazing feeling. Thank you. So P.S. see text evidence from a recent weekend I spent with my daughter. Telling her to buy whatever she wanted for us to eat felt awesome. And P.P.S. I told my GI all about your course and how it helped me. He asked for your IG account and said, wow, I think you taught me more in this visit than I've helped you. So you can read there. She told her daughter asked her, there's nothing you can't eat, right? Nothing. And that is possible. Now, some people do have certain food triggers, but for most people with IBS, improving your lifestyle is going to be key to improving your symptoms. Okay, so this is something I want to share with you. Let's keep moving. Now, the IBS Freedom approach has helped hundreds of people with IBS reach their goals and truly find freedom from IBS. And if you suffer from symptoms like bloating, gas, diarrhea, or constipation, I really recommend for you to join IBS Freedom. It's actually incredibly affordable. And there's no other program like this on the market. So let me share with you what's the investment of the program. Now, normally, don't get freaked out with the number here. Normally, working with me one-on-one is about $4,000 investment in USD. It's a 4-month program to help people get better and really understand what's going on. But I know not everyone can afford to work with a dietitian one-on-one. And I want to make this easy and affordable for anyone to get started. Let me share with you the cost of the program. So full access to the online portal where the videos, the workbooks, and the recipes are, with the meal plans, over 100 recipes, and also access to private Facebook community, and bi-weekly coaching calls and Q&A with our team of expert dietitians for personalized support. With everything that's included in the program, there is over $1,300 in value. What I wanted to do, and this is something I've always wanted to create, is an affordable program because I know most people don't have access to a trained dietitian, and I can't tell you how many times my client cried in my consults because having IBS is so hard. And I know myself how debilitating IBS can be, and we've experienced it in my own family with my husband, and I talk to my clients all the time. It is very important for me to make this program as affordable and accessible as possible so that you can find relief and IBS freedom. And which is why the program itself is a monthly subscription, and it's only $22 a month. And this is, I will have to say, this price, I got an email from someone the other day saying that they've tried everything. They've tried a lot of supplements. They've went to a lot of practitioners, and they said, I just don't know if I could join a program like this, not knowing if it will help me or not. And I responded to her, the really good thing about this program is it's a monthly subscription. It's only $22. If it doesn't work for you, you can cancel at any time. And it's cheaper. I look at the shelf on the grocery store nowadays. I'm like, wow, everything is so expensive. And I feel like $22 is cheaper than the probably cheapest supplements in an aisle in the grocery store in the US right now. Everything is so expensive. So, and again, like I said earlier, it is my mission to make this affordable. And because healthcare shouldn't be only accessible to those who can afford it. And everyone suffers from IBS. There's no hierarchy of people who suffer. Everyone should be able to find care. And that's what I'm trying to do to bridge the gap here, because there's no program. There's not a whole lot of program out there. Most programs are really expensive. And this is the program that I think is the best because we cover all 3 areas of IBS to help you get better. And it's very, very affordable, and you get continuous support from me and my team dietitians. So, and one thing I will have to say, so the program right now is $22. If you are someone watching the replay in the future and the price on our program page is not $22, then that means we probably had to increase the price due to a variety of factors, and mostly inflation, because running a program like this is very expensive, and I'm still trying to figure out what it takes to run everything. And if it's a slightly higher price than that, know that we have went up in price, and this program will never get discounted because it's already very, very low cost. So I just want to let you know about that ahead of time, in case this is not the same price you see on the program page nowadays. But $22 a month, you really cannot beat that. All right, to thank you for joining me today, I have a few bonuses for you. Number one bonus is the Gut Boosting Smoothie Guide. And this is to help you include more variety and more fiber into your day with real food and ingredients that nourishes your gut and your gut microbiome. So this is something I think is really important and very useful tool for people. You can use smoothie for breakfast or snack. It's convenient. I did a poll on Instagram earlier today, and most of the people that answered my poll said they didn't eat breakfast. Breakfast is really important. So even if you don't have time to make a breakfast, you can always make a smoothie and keep it in the fridge and drink it on days when you don't have time to make breakfast. So I love my smoothie guide. It's extremely helpful. All right. Extra bonus number 2, my 14-day low FODMAP breakfast recipe. So again, you hear me say it again and again, how important meal timing is and how important breakfast is to ensure you have enough breakfast options for you to choose from. Here is an extra 14-day breakfast recipes that are low FODMAP, high fiber, adequate in protein, and very easy and convenient. And then bonus number 3, this is my top recommendation of supplements and that I recommend to some of my private coaching clients. These are evidence-based, safe, and effective supplements for IBS. There's no bullshit. This guide will help you pick out affordable, safe, and third-party tested supplements that are available in your local pharmacy or online. So when it comes to supplement, we really need to make sure they are third-party tested to ensure quality, potency, and also there's no cross-contamination from chemicals or heavy metal, because we know in the US and most places in the world, FDA does not regulate supplements. So recommending safe products and affordable products is extremely important for me. Now, I would love to invite you to join IBS Freedom. Oh, also, quick note, there is a monthly subscription available and you can cancel anytime. But if you sign up for the annual subscription, you actually get 3 months free. And this is a great investment if you've struggled with gut symptoms for a long time, and if you've had a lot of conflicting information everywhere and just don't know what to do. Now, I do recommend getting the annual subscription so you get 3 months free, because working through the program probably takes around 6 months. And sometimes life happens. So, you paid a little bit more, but you have your peace of mind that you will have a 1-year access to the program to make sure you're working through everything step by step. And even if life happens, you have some buffer to keep working through it. And more than that, you continue to get support from our team and our community. So I think this is a better investment. It's about $60 more for 1 year if you do the monthly subscription. It is still okay, but you do get the 3 month free. So just FYI out there, let me pop up the link for you to join, and I'm going to answer some of your questions. And someone said, without bloating, traveling would be easier. Oh, traveling is so much easier. And in Module 6, I know this person is already a member in our program. In Module 6, we have, let me see, how do I share the offer here, the link? We have a guide to help you prepare for travel, for holidays, for special occasions, because those are the times where issues really arises, right? When your life changes, when your routine changes, having a plan in place is going to help you prevent symptoms from coming back and have the tools to tackle the symptoms if anything do happen. So there you go. Let me know if you don't see the link to sign up, but the link is in there. Let me share one more client story with you. This is Jessica. Jessica has IBS diarrhea, lots of urgency, near accident experiences in public places, and she was very, very traumatized. She works with her GI doctor, and also she works with an alternative medicine practitioner for the past 6 years before working with me. She never gotten long-term relief and spent thousands of dollars on supplements. Whenever you have to buy a lot of supplements, run. Those are scams, okay? She was recommended a lot of really strict and restrictive diets. Low FODMAP, going vegan, cutting out carbohydrate, going carnivore, and worse yet, she was even recommended to just drink protein shake to contain her symptoms. Now, when we started working together, I helped her increase the variety of food she was eating, but we still followed the low FODMAP diet because she was so restricted before working together. What we ended up doing was expanding her food choices within the low FODMAP realm to help her feel better. And we also identified her food trigger to stop her diarrhea for good. So after following the IBS freedom approach, she said after a week or two of working together, 1 week into the modules, she has learned so much more about IBS and herself than she has in the past 6 years working with a naturopath. So I want to really caution you when there are programs that tell you to do a lot of tests that your GI don't recommend. Those are usually scams. And then if they recommend a lot of supplements, those are usually scams as well. And I hate to say it, I have heard this from clients again and again and again that they've spent thousands of dollars on supplements and nothing works. And they don't know whether they should continue or not continue with the supplements because they're not seeing much effect, but they're afraid of stopping because they're afraid that things will come right back if they do anything wrong. So what my advice is, there's very few supplements that I recommend, and there are very few that are actually researched to help IBS. And I include those recommendations in IBS Freedom for you, so you have the resources to choose the right thing for you. All right. Okay, let me answer some of the common questions I get. So this is a question that I hear from a lot of people. So they usually say, I've tried a lot of different diets already. How do I know if this program will help me? So a lot of people tell me they've tried a lot of diets. How would they know? So I want to tell you this program is not just about diets. This program is to help you identify what is causing your gut issue. Then we provide a holistic approach for you to learn more about your body and know your own individual trigger. This is not a diet. In fact, the program is here to help you break free from the fear of food by properly identifying your food trigger and what your tolerance level is toward these foods. A lot of people come to me with very few foods they feel safe eating. And after working together and properly identifying their triggers, they are much more confident in the food choices they make, and they know their body a lot better. This program is not about diet. It is about you. Okay, how soon will I start seeing results? I always say a lot of people tell me they start feeling better within 2 weeks, especially for more of the chronic constipation cases, because I do teach you how to dose laxative. And when you get on low FODMAP properly, you also find relief as well. And if you follow all of my guidance, some people can even see symptom relief in as soon as 1 week. But there's no guarantee because gut disorders are very complex. As many of you know, you've worked with a lot of doctors or providers already. It is complex, but with the right framework, you are going to be more informed about your body. And it's also going to help you to have an informed discussion with your provider as well, so that you can choose the most appropriate treatment for your specific condition with your provider. Okay, how long will I have access to the material? How long does it take to work through everything? So you will have full access to all the materials, videos and files and workbooks as soon as you join IBS Freedom for as long as you are a member. So you can cancel anytime. So for example, if you have the monthly subscription and you click cancel, your access will end at the end of your payment period. Or if you have the annual subscription and you click cancel, your access will end at the end of the year of the subscription. So it won't end right away when you click quit, when you click cancel, but it will end at the end of your subscription period. Usually, the length of working through IBS Freedom varies. Some people have gone through the program, implemented everything, and they found relief around 4 to 6 months. I would say that is the norm. Some people take a little bit longer. So I really recommend getting a 1-year subscription to make sure you have enough time to work through everything and continue to get support through that year, because you're going to hear a lot more from me and my team dietitians to help you continue to improve. To get the community support, and also and a lot of people like to stick around the program too, is they get the community support and also ongoing support as they travel, as they attend event or go through BC work seasons, because those are the times when your life's going to be different, and a lot of the times when symptoms may come back. So again, I do recommend getting the annual subscription, so you get 3 months free. It's cheaper for you to join that way, and to make sure you have enough time to finish the program and make sustainable lifestyle changes for long term. All right, so this is again your invitation to join. The link is already there for you if you want to click to the program page to learn more. And I want to say thank you for joining us today. And I'm going to go and I've already published that. Let me go ahead and share with you the 7-day low FODMAP meal plan so you can download it. And I'm going to go into Q&A. Give me 1 second here. And I want to just say thank you so much for sticking around. I'm going way over time, and we had some technical difficulties in the beginning. So it's the file for the meal plan guide is already in the link. The link to download it's already popped up. Do you see that? Let me know if you see it. Okay, I've got some questions here in the chat and some in the Q&A. Oh, thank you so much for joining me. I'm really happy you are here, and good luck with working through IBS Freedom. This is a member of IBS Freedom, and I really enjoy having a supportive member in our program. Okay, we have one question. Do I need to meet with my GI doctor to determine if I have IBS? Now, if you don't know if you have IBS yet, I would still encourage you to join IBS Freedom and work through Module 1, because in Module 1, I really talk about how to document your symptoms. When you document your symptoms and you go in to see your doctor, you present your condition a lot more clearly to your doctor, and that's going to help them have more clarity on what's going on with your body and get you to the right diagnosis faster. So in Module 1, for example, I teach you to document where your symptoms are. Is it upper GI, lower GI? Where is it at? What symptoms do you have? Do you have bloating? When does it start? How long does it last? What type of bloating is it? Do you have cramping? Again, where's your cramping at? How long does it last? When does it happen? What is your frequency? Like, these are all things that your provider, myself included, would like to know. So if you watch the modules, you really learn about documenting all of this before going to your doctor, and you will get to the correct diagnosis faster. And gut disorders are really difficult to diagnose. And sometimes, on average, I would say it takes, per research, it takes a person about 6.5 years to get an IBS diagnosis. But if you know how to document your symptoms and how to present your symptoms, you will get clarity a lot faster and get to the right diagnosis a lot faster. Yeah, and there is also a comment about hesitant to travel, not knowing what foods to eat or not to eat, need to start the low FODMAP diet. So if you need to start the low FODMAP diet, I would say definitely join the program. I have all the resources you need there, and you can ask us any questions about the low FODMAP diet. And we have a resident, one of our IBS dietitians. She is a recipe developer who has IBS herself. She knows food inside and out, and she can answer a lot of your questions when it comes to low FODMAP diet. And of course, I'll be there to support you as well. But we have a team of amazing GI dietitians in the program to support everybody in the program. So let me know if there's any more questions. Let me see. Let me click the Q&A there. I think these are the ones that I can only see. I have a lot of constipation, seen doctors many times, tried laxative, never really quite worked. Now whatever I eat causes bloating. This is quite common for people with chronic constipation. And the thing about constipation is, if you have stool stuck in your colon, it is going to ferment. It is going to cause bloating. It's going to cause gas. So the first step is really to regulate your bowel habits using some over-the-counter laxative. And in the program, in Module 1, I actually teach you how to dose laxative up and down. Now, the program is not to replace your one-on-one care with your healthcare provider, but it's really going to fill in the gaps that your provider didn't teach you when you went in there. Because a lot of the times for people with chronic constipation, the first thing a doctor say, let's try some laxative, let's try Miralax and see how it goes. What they don't say is oftentimes Miralax is dosage dependent. You need to adjust your dosage to find relief. And in the program, I teach you how to do so. I don't have a picture here, but I have a chart of how to dose Miralax up and down. Like once you have a full evacuation, then that's when we start dosing down. If you don't have full evacuation, if you still have all of these symptoms, then you slowly increase the dosage to one point. Now, if that doesn't work, then we may combine it with a different over-the-counter laxative. I see there is another question on here about Linzess. So this is, again, for people with chronic constipation. Linzess is a very common recommendation from GIs if other laxatives don't work. And what Linzess does, so Linzess is a prescription laxative. And what it does is that it contains a stimulant laxative and it contains an osmotic laxative. So you can think of it as Miralax and Senna combined. Now, you can try Linzess. It works for some people. It does take time to work. Make sure you talk to your healthcare provider about how long to stay on it. What are the signs that it may be working? Now, like I said just now, Linzess is a combination of osmotic and stimulant laxative. There are actually over-the-counter laxatives that have those functions. Miralax is an osmotic laxative. Senna is a stimulant laxative. If Miralax alone doesn't work, you can pair with Senna, but you want to find the right dosage for you. So instead of trialing Linzess, like the prescription grade things, you can try the over-the-counter ones first. And I like recommending the over-the-counter ones to my clients first before they try the prescription grade ones. It's because it's a lot cheaper. It's a lot more accessible for most people. And they are FDA regulated, so you can feel safe using them. Now, in IBS Freedom, I really teach you how to dose, when to dose, and when to switch to a supplement that can help you have better evacuations. Usually it's once your bowel habits are more regulated, then that's when we say, you can transition, and I walk you through step by step how to do that in IBS Freedom. So that's about constipation right there. And a lot of people with constipation do find relief really quickly once they learn how to dose laxative. And when they find relief, the bloating is a lot better and they feel better, their appetite is better. And that's when also they can work on some of the dietary changes that we talked about earlier and implement the lifestyle changes. When you feel better, it's a lot easier to implement all of the things. Oh, I forgot to say one thing. The bonuses that I just shared earlier, they are good for 3 days after the webinar. So make sure to join IBS Freedom within 3 days of watching this webinar to get the bonuses so that you have all of those extra resources for you. Okay, let me see what other questions we have here. And again, I want to thank everyone for joining me today. If you have extra questions, pop it in the chat, pop it in the Q&A. Someone said here they've done the low FODMAP diet for a while now, not receiving a lot of symptom relief and really don't know what to do. And when they try to eat low FODMAP foods again, try to eat high FODMAP foods again, it causes them a lot of symptoms. Now, this is something I said extensively earlier in the webinar, is that most people don't know how to implement low FODMAP properly. And oftentimes, I'm going to use a constipation case, Jennifer's case that I shared earlier. For most people with chronic constipation, if you go low FODMAP and remove a lot of the fiber from your diets, that can actually slow down your gut motility even more. Now, when you're on low FODMAP, when you're constipated, you won't be as bloated because there's no fermentable carbohydrate causing the gas and bloating. So in those cases, if you eat anything that is slightly higher in FODMAP, that can cause you to bloat right away because things are really stuck in your gut. So with those cases, really work on improving gut motility first before you reintroduce FODMAPs one group at a time. And it is very important to reintroduce the FODMAP foods so that you can expand your diet. You don't have to limit to such a small group of food and you can live a more normal life. The key is to resolve the root cause while you are on the low FODMAP phase, because that's going to be very important. And the reintroduction part is important as well, because that's going to help you understand what you tolerate and what you don't tolerate. Okay, I think that is about the questions we have. There is a question about diarrhea. So a person said, I have a lot of urgency throughout the day. I don't know if it's overflow diarrhea or if it's like a flare-up diarrhea. I never feel empty. Now, in cases like this, I would really recommend working through FODMAP or maybe even the gluten-free protocol, because sometimes this can happen because of overflow diarrhea. Try using some laxative, resolve the constipation first and see if that still happens. If that still happens, when you've really cleaned yourself out and you still have little bits and pieces of bowel movement through the day, then that's when I would suspect a food intolerance. And that is when you want to work through the FODMAP protocol properly. And also, if that still doesn't work, then work through the gluten-free protocol with reintroduction properly. Yeah, it's a common thing that I see all the time, but most people with IBS diarrhea, it is either flare-up diarrhea or IBS mixed bowel type that is caused by chronic constipation. So work on both things, and in IBS Freedom, I lead you through all of that as well. All right, thank you so much everyone for joining. I am really glad to see you here, and I hope to soon welcome you inside IBS Freedom. All right, everyone, you have a wonderful day and a wonderful week, and I'll see you in our support community soon. Okay, all righty. Bye, everyone. Thank you for joining me.